Hey everybody, this is Dr. Justin Leeman with Reshape Physical Therapy. Today I'm here in our Ashburn location, located inside of Gold's Gym in Ashburn, Virginia. I just wanted to post a quick video today discussing a common myth and misconception that I've heard throughout the years, and I've heard it quite a few times over the past couple of weeks in the gym. So the myth or misconception is that when you're squatting as an exercise, you're not supposed to let your knees pass in front of your toes. Or you may have heard you're not allowed to let your knees track in front of your toes. To give you a visual of what that looks like, this is your lower leg. Up here would be your knee joint. When you squat down, people are saying you're not allowed to let this happen. Not allowed to let the knee pass in front of the toes. And that the safer position to be in, or squat in, is to have that lower leg as vertical as possible. Okay? So this is a myth and a misconception. People think that if you allow that motion to happen, if the knee passes in front of the toes, that could cause an injury or predispose you to an injury. And I don't think that's necessarily the case. I found an article by Fry et al., which was published in the Journal of Strength and Conditioning Research, and they looked at this. They looked at what happens to the force at the knee, the hip, and the low back when you allow that motion and when you limit that motion. What they found was if you restrict that motion and you don't let the knee pass in front of the toes when you squat, it does decrease the force at the knee, but it increases forces at the hip and the lumbar spine. Okay? If we're decreasing force in one area of the body, it's going to go somewhere else in the body, and that's a natural thing that happens. So what do we do with this information? Do we restrict that motion? Do we allow the knees to pass in front of the toes a little bit, or do we try and keep that lower leg as vertical as possible? And the answer is, I think it depends on the person. If we're working with somebody who already has knee pain, maybe we want to try and limit that motion, because we know if we keep that lower leg vertical or more vertical, it decreases the force at the knee. So if somebody already has a knee issue, knee pain, maybe we want to try and address that and limit that motion. But if we have somebody without knee pain, maybe somebody's going through a strength and conditioning program, or they're getting ready for an upcoming season in their sport, and we're working on squatting, and I notice a little bit of that motion where the knee passes in front of the toes, that's not something I'm too concerned about. That's not something I'm really going to try and correct. If it's an excessive amount and I'm really noticing a lot of motion and the knee's really going far forward in front of the knee, maybe I'll try and correct it. Maybe I'll try and find the limitation, because they're compensating for something, which is why it's an excessive amount. But I think the natural motion is to have some of that anterior translation where that knee goes in front of the toes. I think that's a normal motion to have. I would be more concerned about the in and out motion, that valgus and varus motion at the knee during a squat. If I notice that, and to give you a visual of what that would be, when you squat, if the knee is going like this, especially going in, that's something I want to try and correct, because that can definitely predispose you to an injury or cause an injury when you're squatting. But normal squatting, if you're noticing that, when you're going through that exercise, don't be too concerned, don't be too alarmed. It's not really a big issue. If you're concerned about it and you think you have an excessive amount of that motion, or maybe you even notice that in and out motion, that valgus and varus motion when you squat, let us know. Come on in for an evaluation. Let us take a look at your squat form, and maybe we can try and address it and correct it. But if you're squatting and you notice a little bit of that motion at the knee, don't be too concerned, because it is just a myth, and it's a misconception, and I think it's a normal motion to have when you go through that exercise. Okay? Again, if you have any questions, comments, concerns, if you want us to take a look at your squat form, give us a shout. We're here to help you. I hope everybody has a great day, and keep moving.